Coming up today on LinkedIn News Live, President Joe Biden says the U.S. aims to return to normal by July 4th. We speak with an expert from CVS Health about how the vaccine rollout is playing out. Plus, the debate on the return to work and what the nation's top business leaders are saying. All of that coming up next. Hello, I'm Devin Banerjee, and welcome back to LinkedIn News Live, where the business conversation begins with you. It's Wednesday, March 17th. Here's a quick look at the top headlines professionals are discussing today. Atlanta shootings leave 8 dead, fueling racial attack fears. Amazon Care is expanding across the U.S., and CEOs are split on the return to office. Let's take a deeper dive into that last story and what it means for those in the industry. Corporate America is poised to return to work, but among top executives, opinions differ on when and how workers should return. The Wall Street Journal reports leaders are divided on how companies can sustain productivity levels with remote staffs, how they can resume business travel, and more. Here to dig into this for us is LinkedIn News Managing Editor Beth Kutcher. Beth, welcome to the show.
Hi, Devin.
So as you know, we're entering month 13 of this pandemic and the restrictions that are associated with it. Why is this topic and this issue coming to the fore now?
Well, the vaccine rollout is going much better, much faster than expected, especially now that we have 3 vaccine candidates. And in fact, President Biden has challenged states to make sure that they expand eligibility to everyone by May 1st, which is really just around the corner. And when you think of it that way, this discussion of when people can come back to the office and resume some sort of normal work life has become very real, very fast.
Absolutely. There is light at the end of this tunnel, finally. Beth, do you find that certain industries are more keen to bring workers back more quickly, while others may be more amenable to a new hybrid model of work?
I think a lot of tech companies have come out very strong, very fast on this. In fact, most of the major consumer tech companies that you've heard of that are based right here in Silicon Valley, they've come out very fast saying, if you want to continue working remotely, if you want a hybrid option, we're going to support you. And it hasn't just been tech companies. There have been other companies in other cross industries like Nationwide Insurance, REI, the consumer sporting goods store, Siemens, the big German conglomerate, and they've all been very supportive of remote work. And then on the other side of the equation, you have perhaps a more conservative industry like finance saying, we're not so sure about this. You have Citigroup and you have Goldman Sachs being a little bit more reluctant. So you have David Solomon over at Goldman Sachs saying, it's an aberration. We really don't think this is the future. And then you can contrast that to a company like Salesforce, which is saying that the 9-to-5 workday is dead. So really 2 very different takes on this.
Yeah, absolutely. It's going to be very interesting to see how the industry is split when the rubber meets the road in just a couple of weeks. Beth, at the end of the day, employees are the ones, producing the work. What do we find that they actually want? Is there some data out there that shows?
Well, there actually been a lot of polls that people have been posting on LinkedIn. We've posted a number from the LinkedIn News page. Our editors have posted polls, and the results actually, even though these aren't scientific at all, the results have been fairly consistent whenever someone posts this to their network, which is that the most popular response is the hybrid option. So it's not, we want to be home permanently. It's not, we want to return to the office. It's that we really want flexibility. And when you think of 2 industries that compete head to head for talent increasingly, like tech and finance, especially in major cities like New York, where tech companies are really changing the landscape there, you have to wonder whether or not their reluctance to go to a flexible work schedule is going to hurt them in the talent wars.
Absolutely. This return to work is going to have so many ripple effects and implications on associated industries, associated groups of workers. One of those that's been really fascinating to watch and unfortunate for landlords and their lenders, et cetera, is the commercial real estate space. What will these trends mean for office space going forward?
It's a really good question. I think we've seen a lot of headlines recently, especially if you live in a big city like New York or San Francisco, that big companies like JP Morgan Chase, which has been, even though they're in finance, they've been supportive of working from home, or Salesforce, the largest employer in San Francisco, saying that they're canceling leases, they're reducing their footprint. And so there's a question about what that's going to mean for the future of downtowns, especially for small businesses that rely on office foot traffic. Another interesting part of the equation, though, is that for the office space that remains, what is it actually going to look like? If employees are saying they want a hybrid model, chances are it's not because they want to come back to a cubicle farm. Chances are it's because they want the communal spaces and the camaraderie and the socialization. So I think actually the office itself, whatever is left, is going to look really different, and it'll be interesting to see how that plays out.
It will be very interesting to see. And, today's show, Beth, is about the vaccine rollout and distribution. Is there a relationship between the speed and efficacy of that rollout and how business leaders are planning for when and how workers return to offices?
CEOs have really come out to advocate for vaccinations, whether they're trying to make it mandatory or they're offering incentives, financial or otherwise, like paid time off. And I think, as supplies ramp up, we could very well see employers partnering with some of the care providers, like flu shot clinics. Now you can have a COVID vaccine clinic in the office. Obviously, that's going to depend a lot on supplies, but I think it's definitely a possibility we might see going forward.
We're absolutely very interesting. We're going to be watching this story very closely over the coming weeks and months. Beth, thanks for joining us today.
Absolutely. Thanks, Devin.
That was Beth Kutcher, Managing News Editor at LinkedIn, breaking down that story for us. For more stories like these, check out the news module to the right of your LinkedIn feed. Or if you're on mobile, click into the search box. Now, it's been about 3 months since the first COVID-19 vaccine was administered in the US, and now over 110 million doses have been shot into arms. Just last week, President Biden announced his plan to make all adults eligible for a shot by May 1st. Along with a multi-tiered plan to make availability more equitable, including using pharmacies to increase access to the vaccine. Joining us now to discuss these efforts is Dr. Kirsten Anderson. She's clinical lead for CVS Health's infectious disease response team. Dr. Anderson, welcome to the show.
Thank you, Devin. It's great to be here today.
I want to begin with us being LinkedIn, an employment and skills angle here. I'm very curious how CVS Health has been staffing up to aid in this vaccine rollout. What particular roles or skills have you been seeking in recent months?
So in the recent months, CVS has been seeking the skills of pharmacists, interns, technicians, nurses to help with the vaccine rollout. As you know, we do flu clinics. We do those in our pharmacies. We do on-site flu clinics. And so we have a very, a well-set plan to be able to vaccinate people in the locations where they choose. And so we have rolled out vaccinations in long-term care facilities across the country, and we're very proud to be part of the solution. We have administered over 4 million doses of coronavirus vaccines in skilled nursing and long-term care facilities. So it's great to be part of the solution. We're also rolling out vaccines, obviously, in our pharmacies. And so in total, we have administered about 6.5 million doses of vaccines in over 1,200 pharmacies. And we continue to increase the number of pharmacies who have the availability of that vaccine. So very proud to be part of the solution here.
Now, Dr. Anderson, as you've probably heard and read, and many people are talking about, equitable access to the vaccines has really been top of mind in different parts of this country. Now, this is improving as more people become eligible to receive the vaccine. But at the outset, the vaccination rate for Black Americans has been about half of that of white Americans. The gap for Hispanic people has been even larger. So there are these barriers that are disproportionately affecting communities of color. What has the role? What has the role been of CVS Health and others in making this access more equitable right now?
So CVS is committed to the equitable distribution of the COVID vaccines. It's something that we take very seriously. We are doing a multi-pronged effort to be able to promote equitable access. One of the most important things that we can do is be in the community. Not only do we partner with community organizations such as the YMCA to help with the administration of vaccines in underserved areas, but we are in underserved areas. We have pharmacies in multiple places where health equity has been a problem. And because of this, we have a way of understanding our social vulnerability index, which is something that's defined by the Centers for Disease Control. We can target the distribution of vaccine to the pharmacies that are located in disadvantaged areas that are indicated by that social vulnerability index. So we are actively distributing vaccine where it's needed the most and partnering with communities to make sure that vaccine gets to the people who need them the most.
Yeah, it's great to hear that there's a use of data here to manage how this is going. Dr. Anderson, I want to take a moment to welcome some of our viewers in the stream. Dolores from Texas, thanks Dolores for joining us so consistently on the show. Wendy from Connecticut, Lorena from Colorado, Stephanie from New Jersey, Raymond from North Carolina. It's great to see all of you again. Please remember you can add questions in the stream during the show, and I'll do my best to pose some of them to Dr. Anderson as we proceed. Dr. Anderson, what are some of the largest pain points right now, some of the largest challenges in this vaccine rollout?
So let's think about the vaccine rollout. Usually when a population is vaccinated, we do that when people are children. So children go to multiple doctor's visits over the course of many years and get vaccinated for all the diseases that we know about, measles, mumps, rubella. This is 100% different. We are trying to vaccinate the entire population of the world. And so one of the frustrating parts is that it's just a massive effort. It takes all of us participating together to be able to make this happen. CVS is proud to be part of this, but it takes all of us, all the pharmacies, all the health systems, to be able to roll this vaccine out and get it to as many people as possible. So it's a massive undertaking, but one that we are prepared to do in partnership with other healthcare systems. We anticipate being able to deliver between 20 and 25 million doses of vaccine a month when the supply is available. So the frustrating thing is waiting for the supply to be available, but the one thing that we know is going to happen is we'll be able to get it into arms as soon as we get it.
Now, as that supply comes online and the pace ramps up, do you see the distribution changing in any way? And are there some lessons you've learned, so far in recent weeks that you can apply going forward?
I think the lessons that we've learned in recent weeks is that people really want this vaccine, and that as many appointments as we have are usually filled. And so that's one of the main lessons that we are taking away is let's open it up, let's get more people vaccinated, let's make sure that we can communicate that in the communities where the patients live.
Absolutely. Let's take a moment to say hello to some new viewers joining us. George from Utah, Donna from Boston, Jeff from Florida, Jacqueline from California. Thanks for joining us. Remember, you can put your questions in the stream and I'll do my best to pose some of them to Dr. Anderson. Dr. Anderson, we do have a question from Dolores who is asking, does CVS carry Pfizer, Moderna, and Johnson & Johnson vaccines, or which ones are you carrying right now? And can the customer choose which one they receive?
CVS is carrying all of the vaccines. Each store only has one particular kind. So if your local store is a Pfizer store, then that's the kind of vaccine they will continue to have over time. So can patients choose? One thing that's very important about this is that the vaccine that's right for you is the vaccine that's available to you. So I suggest to everybody to please get vaccinated, and choosing is less important than getting vaccinated with what is available. So when you do make an appointment on CVS.com, you will be able to see which vaccine you will be receiving.
Dr. Anderson, as you and I are speaking right now, Dr. Anthony Fauci is speaking in front of a House of Representatives subcommittee, and really what his focus on today are the variants, the mutations to this SARS-CoV-2 virus. Anik in the stream right now asks, how are these variants on your radar? As we learn more about them, will they affect the vaccine distribution?
So the variants themselves won't affect the vaccine distribution, but what may happen is that if we require a booster due to variants, then we will have to operationalize that. And we've been able to operationalize the vaccine rollout. That would not pose a problem for us. So the variants are a problem because if they are more infectious, then what they do is they spread. So what we are in right now is a race to vaccinate as many people as possible before the variants spread. And so we're trying to vaccinate very quickly so that we can get ahead of it and the variants will not take a major foothold in this country.
So in this race, as you call it, to vaccinate as many people as possible, you've also mentioned partnerships, partnerships with others in the healthcare system to ensure that this goes as effectively and as quickly, candidly, as possible. How do you view the role of employers, for example, or insurers in this vaccine rollout? How are you partnering with them, and are there plans to partner more with them?
So we do have a partnership with employers that is based on our flu shot model. So employers can ask for CVS to come on site to do a flu shot clinic. So at this moment in time, we are partnering with certain employers whose workers are considered to be in, essential workers. If they have an allocation from their state and they're more than 1,000 employees, we are in a partnership with them to be able to go on site to do vaccinations. So that's one thing that we're able to do. The second thing that we are able to do as an insurer is to do outreach. So we have a very aggressive campaign to do outreach to patients who are vulnerable, elderly patients, patients who may have other serious medical conditions. We can do outreach to them. We can do electronic, we can do text, we can do email to encourage them to get vaccinated. Patients who are in our care management programs also are able to have us help them make an appointment to get vaccinated. So we are we're right there with people hand in hand, helping them to get the vaccine.
Yeah, that's so fascinating. And on that point, Dr. Anderson, we've seen the role of the pharmacy be so key in this pandemic, especially this stage of the pandemic, ending the pandemic. How do you see the role of pharmacies changing in future pandemics? Knock on wood, hopefully we don't have them or many of them, but how do you see the role of the pharmacy changing going forward?
The pharmacy is in the community. The pharmacy is where the people are. The people who work in the pharmacy come from the community. The pharmacy is a trusted source of information, as are the pharmacists. So what I see the role of the pharmacy in the future is to help with more extensive disease prevention, more extensive health promotion. So how do you promote people to be healthy? Not just about coronavirus vaccination, but flu vaccines, other vaccines that are necessary, tetanus, shingles, vaccines like that. So a pharmacy can play a greater role in promoting the public health of the community. I think it's so important because the pharmacists are part of that community.
Dr. Anderson, we actually have many healthcare workers joining our stream right now, and they're planning their own, organizations, distribution strategies. We have Dr. Knoll in the stream asking, can you share some more best practices in ensuring smooth vaccination operations? How are you minimizing wastage, for example? And how are you thinking about your appointment scheduling system, for example?
One of the things we're very fortunate to have at CVS Health is an incredible infrastructure for the digital environment. I think that I work with the most incredible people at CVS because they have been so nimble and so flexible in rolling out the Vaccination Appointment App. The app is really impressive. You can go onto the app, you can make an appointment, and at that same time, you're asked to make an appointment for the second vaccination. And this is something that we leverage our ability to understand how people want to be communicated to in terms of reminding them. So we text people, we send them emails, we send reminders that say, you're made an appointment for a vaccine, make sure you show up. And once you have shown up, then here, please come back for the second one. So we have multiple ways of engaging patients who have made that appointment at our CVS sites that we really think is industry leading and simple. One of the problems with the sort of registration for these vaccinations is that it's been a bit complicated. We strive to make it simple. We strive to make it easy. We understand that people who are our parents, our grandparents, it's hard to navigate this. The CVS online scheduling system is very simple, and I think that that's a critical way to improve access to vaccinations.
This distribution, Dr. Anderson, is really just ramping up. You and your team have a lot of work ahead of you What's sort of top of mind for you and as you communicate with your team over the coming weeks and months? What are your priorities right now?
My priorities are to address hesitancy. So I want to make sure that if there's vaccine hesitancy, that we understand why and that we get to the people who are hesitant for whatever reason. Right now, we are in a situation where there's much more demand than there is supply. Soon we will be out of that situation. We will have a lot of vaccine. How do we make sure that people understand it's safe, it's effective, and it will help this country, along with our other initiatives around mask wearing and social distancing? It will help us come out of this dark period. It is the light at the end of the tunnel. So top of mind for me is get everybody vaccinated and address hesitancy.
That light at the end of the tunnel, I think, is motivating all of us. Dr. Anderson, thank you for the work that you and your team are doing, the credible information that you're putting out there, and we appreciate your time today.
Thank you. It was great to be here.
That was Dr. Kirsten Anderson. She's clinical lead for CVS Health's infectious disease response team. Don't forget to join us tomorrow at noon. We're back with an interview with JP Morgan Chase Vice Chairman Peter Scher to discuss the future of work and the economy in a post-COVID world, which we are quickly approaching, hopefully. I'm Devin Banerjee. Thank you again for joining us today on LinkedIn News Live.